So the question is often in many people's mind is, what does it mean to be seen by a psychiatrist? I think the first thing to stress is that often there's a perception that the answer will be there at the first go, in the first 5 minutes or 10 minutes of meeting a healthcare professional. That's not the case. Often it is a journey. And part of what we do is an assessment where we talk about who you are, the narrative of who you are as a person. I think part of the challenge within healthcare services is often we medicalize everything and we don't think of the person as a person, and we instead of think of them as a group of symptoms and signs, and that's not healthy and that's not useful and it's not real to the individual. So when you meet a psychiatrist, often they will tell you to talk about your story, about who you are.
Your background history, that will include your medical history, any history you've had with mental health services, but also a really clear biography of your life, you know, what you were like as a child and how you've been functioning as an adult. We might ask you about any problems you've had with addictions or important relationships you've had in your life. We might even think a little bit about the kind of person you are, the kind of personality you have, and how that helps or hinders you in your life.
Not only that, often it's quite useful to get a sense of how other people view you as well. Friends, family, people who may have worked with you before, because your perception of who you are is one aspect, but the other aspect is how society and those around you view you as well. So that's the initial stages when you see a psychiatrist.
If you were coming to see me for an ADHD assessment, we would do exactly the same thing initially. But then we would go on to have a more in-depth consultation, thinking specifically about ADHD symptoms and really trying to get a sense, do you have these symptoms? Do you have these sort of personality traits? And actually, though you have them, they don't affect your day-to-day functioning so much and you're okay. Or is this really getting in the way of your day-to-day life in lots of different ways? And has it done so over years? And so that's really trying to get a sense of, is it a disorder or not? So that's the general process of assessment. So after we've had the initial assessment, we would generally have a follow-up session in which we might sort of put it all together, think about diagnosis if that's relevant, and then think about what we can do next. And the options may be nothing more beyond that actually it was useful to think that through, to sort of get an understanding of what's going on, and you may want to go away and just mull that over, and that may be a transformative or useful experience in itself. However, I think a lot of people will want to think about, what can I do now? Now I've got this sort of diagnosis, or we've had this problem described in more detail, what are the next steps? And that might include a referral onto a psychologist, it may include some lifestyle advice about how you might do things differently, or it might include medication. And for each of those things, it's probably good to have a few follow-ups. So you have one where we discuss a plan and then we make some changes and then we follow things up and see how those changes have gone, how it's affected both the difficulties you're having, the symptoms you're having, and also how it's affected your life generally. Like, okay, your symptoms might have improved, but life hasn't really changed. Well, then we need to think about why that is and what we could do differently.
So, for example, if you were to take an antidepressant medication, for example, it would be important that you were closely monitored, that any improvement or side effects were picked up, and if any changes needed to be made, we could make them.
I think particularly with medication, it's really important to have follow-up, to think about what are the benefits you're getting from medication and what are the side effects you might experience. Because I think people can have side effects, and it's important not to sort of suffer them in silence or to think, that's it, this is not for me, because there might be other options. So it's really having that conversation and having that continuity is very useful, particularly for ADHD, or I suppose when we're talking about ADHD particularly, we often will make a lot of adjustments to medication that are very personalised, that are sort of thinking about how the medication affects your day-to-day life and when you may best use it. And also, we can make adjustments to medication more quickly than we can sometimes do with other medications, which may take months for us to really sort of monitor. So sometimes when you come in for an ADHD assessment and follow-up, you may have a few follow-ups in quite close proximity, so maybe over a few months, for us to really adjust the medication and sort that out if we are going down that route.
Different people want different things. So some people might come to see a psychiatrist just for a one-off assessment to get some answers. Someone else might want a short course of treatment, possibly for an episode of depression, which might last, 6 months, a year. And others, I think, want a more psychotherapeutic relationship with a psychiatrist. They may want to come back on a regular basis for months or even years. And that's something we can work out collaboratively with you. What exactly it is you're looking for.
I think it's important to stress that although diagnoses, although treatment, all that is important, it's also important for healthcare professionals and for psychiatrists and psychologists to state when that what you're experiencing may be normal. It may be a normal reaction to living, to life. And that will come up from those discussions as well going forward.